Hello, this is Les Goldstein, president of Personal Financial Strategies, a financial planning firm located here in beautiful Park Ridge, Illinois. And this is one of a series of webinars that we will be creating for our clients, their friends and family, designed to educate and enlighten you as to very important financial planning topics that will impact your life with a high probability at some time. So, today's webinar is on what I refer to as the 800-pound gorilla sitting in the middle of your room that nobody wants to look at. And that is addressing the question, what happens if you get sick or disabled on a long-term basis prior to death? So we're going to talk about this now, and hopefully this will add some value to your life as well as some clarity as to what to do to guard against this possibility. So let's share some statistics with you first and foremost. There is a governmental agency called the National Association of Insurance Commissioners. They work in all 50 states and the District of Columbia, and their primary roles are to educate the public as to the various types and needs around insurance and to protect the public against fraud and bad practices. So here are some statistics from the National Association of Insurance Commissioners. Number one, 44% of people age 65 or older will need care in a nursing home at some time. 44% of people 65 or older, okay? Of that group, 53% of them will have a nursing home stay of 1 year or longer, okay? Next, and this was new to me until I started doing some research, 37% of the people needing care are 64 years old or younger, okay? This is not just old people. For those of you who know me pretty well, about a year ago when I was 51, I had an issue that could have resulted in long-term disability or death. Thank goodness it didn't result in either one, but it certainly could have, and I was very focused on having my financial house in order. So, some more statistical data. According to the American Association of Retired Persons, finally referred to as AARP, 68% of Americans 65 years old or older will need help with 2 or more of the activities of daily living during their life. And we'll talk about these activities of daily living, or ADLs, later on. Okay? Now, why is this a big deal? Well, let's go now to a 2007 study by the National Association of Insurance Commissioners. And please, you need to inflate these numbers up because this is a 2007 study, and here we are in 2011, approaching 2012. So according to this study, it's $180 a day for a semi-private room in a nursing home facility. That is, in 2007 dollars, $66,000 a year, okay? That same 2007 study said for 3 visits a week, an 8-hour visit by a semi-skilled care provider, you're looking at $16,000 a year just for 3 visits a week, okay? And if you fall somewhere in the middle, you need more care than someone coming to your home, but not care in a nursing home. It was on average about $33,000 a year for care in an independent living facility. So, let's talk about this need, and let's talk about what the government will provide for you and what the government will not provide for you, and go from there. Okay, now, we all get Medicare once we turn age 65. What does Medicare provide for you in the event that you have a long-term disability requiring care? Medicare under the best of circumstances, will provide you with a certain percentage of 100 days care and its cost. Okay, a certain percentage up to 100 days of care. Now, a couple of caveats. Medicare provides care in a Medicare certified and approved nursing facility only. Does not provide care in almost all circumstances at home or in an independent living facility, okay? Medicare provides care only while you are getting better. And the minute you stop getting better, that care stops being provided by Medicare. So Medicare is short-term stays in a skilled care facility that's Medicare approved, period. Now, let's look at another M that's provided by the government, and that's Medicaid. This one's easy, folks. You will not get Medicaid unless you're broke. And broke is indeed that. You have to spend down basically all of your assets, all of your savings, all of your retirement accounts. You're allowed to keep one house, one car, and that's pretty much it to get Medicaid. Now, another way to get Medicaid is to give away all your stuff. And I think most people don't want to do that, number one. And number two, there's a 5-year look-back provision that will pull your assets back into your estate if you get care prior to that 60-month waiting period. And there can be interest and penalties. So you know what? Let's not even go there. So Medicare helps a little bit. Medicaid doesn't help really at all unless you're completely broke. And both of them help almost exclusively in a nursing home only. So let's talk about solutions. And the cleanest and easiest solution is long-term care insurance planning. And so let's talk about long-term care insurance planning and policy design and cost and all those kind of things that people should want to know about. Okay, so in general, policy benefits kick in when a person can't do 2 of the 5 activities of daily living. And let's see if I can get them all right now. Feeding yourself, dressing yourself, bathing yourself, toileting, going to the bathroom, and transferring, like not going from the L to the bus or the train to the car, but going from like a chair to a bed. So if you can't do 2 of these activities of 5 activities of daily living, feeding yourself, bathing yourself, dressing yourself, toileting, and transferring, then if you have a policy, the policy benefits will kick in. Let's step back a little bit though, first of all. Okay, so a quality long-term care insurance policy is designed to provide care for you wherever you may want the care. The care can be in your own home. The care can be in adult daycare. The care can be at an independent living facility. The care can be in a nursing facility, skilled. The care can be at hospice. This is what we in the financial planning business call a continuum of care. Starts out by, if you can't do 2 of the 5 activities of daily living, maybe they install ramps in your home, like we did for my mom. Maybe there's grab bars on the, by the toilets and the bathtubs. Maybe they have to modify your bedroom, okay? Starts out at home, and then as your need, or if your need progresses and gets more and more significant, then you can move from your home all the way to a skilled care facility if necessary. Okay. In its 30,000 feet from above view, let's say, what really is long-term care insurance? Long-term care insurance provides a typically tax-free pool of cash that you will be able to utilize on a reimbursement month-by-month basis to pay for your care. So it's a tax-free pool of cash, and this tax-free pool of cash is created by your initial and your ongoing premium payments. Now, how do you design a plan? Well, there are many factors that go into that, and let's talk about those now. Okay, number one, in my opinion, and it's an educated opinion because I've been working in this space now for about 15 years. We have clients that are receiving care in nursing facilities. We have clients that are receiving care at home. You can choose to ignore this, but if you ignore it, a lot of things can happen. And we'll talk about that in a minute. But let's look at it and what are the key components that you need to know about. One of them is, what's the waiting period that you're willing to pay out of pocket, which we call self-insuring, until the policy benefits kick in? What's the waiting period? Sometimes they call it an elimination period. Sometimes they call it a deductible. How many days before the policy benefits kick in? That's number one. Number two, what do you want as your daily benefit? We see daily benefits now anywhere from $100 to $200 a day in daily benefit. Okay? Number three, for how many years do you want to receive the benefit? This is called the benefit pool. Do you want 3 years of benefits? Do you want 4 years of benefits? Do you want 6 years of benefits? Do you want lifetime coverage? Just like anything else in this country, folks, you can pretty much buy whatever you want. So if you want a gigantic plan with lifetime benefits, you can get it. You'll have to pay for it. It'll be more expensive, and we'll talk about cost later, but you can get it. Okay, so we've got our waiting period or our deductible. We have our daily benefit. We have how long in years do we want that daily benefit to last. Next one. What about an inflation rider? Let's say we pick a $150 daily benefit today. Well, is that going to be enough 20 years from now? I don't think so. So we have to have an inflation rider. Do you want a simple inflation rider? Do you want a compound inflation rider? Do you want the right to buy more insurance later? These are all the things that come into building an intelligent long-term care insurance plan. Now, let's talk about some other significant things here. More in the policy design, okay? If you're married, should you get a shared plan? A shared plan can be very beneficial if you're married, because let's say that you pick an 8-year total benefit pool. Well, maybe the husband can use 3 of the years, and the wife can use 5 of the years, okay? Or the husband can use all of them and the wife can use 0. A shared plan allows you to use each other's benefit pool, okay? Next, in the world of policy design, what are your reliable sources of income during retirement? Do you have a pension? Does your spouse have a pension? What's your Social Security going to be? Just like when we're doing financial planning, we look at what it costs us to live and what our sources of income are. Let's get a policy that's big enough to fill that gap so that the spouse that's still at home, still in the community, has a lifestyle that they want. Okay? So that's another policy design item. How much cash do you keep on hand? And do you do that always? The more cash that you keep on hand in general, maybe the bigger or the longer the elimination period can be. The longer the elimination period, or we can even call it the deductible, the longer the number of days you have to pay out of pocket, and the longer the elimination period, the lower the premium, the lower the cost is going to be. You can get elimination periods anywhere from 0 days to 360. The longer the elimination period, the smaller the premium, okay? Some other things that you need to know. who shouldn't buy or invest in long-term care insurance? And I prefer to call it an investment, okay? It's just like investing in stocks, bonds, or mutual funds. You look at the cost, you look at the benefit, and you determine if it makes sense for you. So here's who should not invest in long-term care insurance. If you can't afford the premium, don't get a policy. If you have limited financial assets, and that's really something to review, one-on-one, or, the two of you and our staff and team. But if you have limited financial assets, don't get a policy. If you think that you can't afford a premium increase sometime down the road, don't get a policy. If your only source of income is like Social Security or Social Security disability, don't get a policy. If you have so much money that you can self-insure, maybe don't get a policy. Self-insure means just pay for out-of-pocket. And I can give you a very fine yet sad example. One of the fellows that I work with very closely here, he's a new member of the Personal Financial Strategies team. He and his brother have been providing care for their mother for 10 years. They live here. Mom is in Fort Myers, Florida. They've spent $600,000 of the mom's money and $400,000 of their own money providing round-the-clock care in the mom's apartment in Florida. They've spent $1 million. They did not have a long-term care insurance policy. Now, if you can afford that, great. Maybe you can ignore the possibilities of you or your spouse needing care. But if you can afford it, get a policy. It's not that expensive, and we're going to talk about policy design later. A couple of other things you need to know. You have to be healthy to get a policy. You actually have to qualify. And there are some immediate disqualifiers. And let's see if I can remember some of them. If you have metastatic cancer, you will not qualify. If you're already receiving some kind of long-term care disability benefit from the government, you will not qualify. If you have TIA, transient ischemic attacks, or COPD, chronic obstructive pulmonary disorder, you will not qualify. If you are using oxygen or walking with a walker, you won't qualify. The applications actually say if you have one of these 7 things, don't even submit the application, okay? So the reality is the time to get a long-term care insurance policy is today, because you're never going to be healthier than today. All right, let's see what other kind of statistics and things here that I want to share with you. Okay. The typical long-term care insurance policy is what's known as tax qualified. A tax qualified policy means that when you receive the benefits, which is your healthcare provider, either a certified nurse or doctor, certifies that you cannot perform at least 2 of the 5 activities of daily living. Remember, feeding yourself, bathing yourself, clothing yourself, toileting and transferring. I got all 5. If you can't perform at least 2 of the 5 activities of daily living, then the policy benefits kick in, okay? Once the policy benefits kick in, the benefits will be paid on a tax-free basis, typically reimbursement. You submit expenses every single month, and then they're reimbursed to you on a tax-free basis, okay? That's called a tax-qualified policy. Another thing to know about policy design is once you start getting the policy benefits, i.e. you're on care, either in your own home or anywhere in these continuum of care world, once you start receiving policy benefits, your premiums will stop. Your premiums will stop if you have a sole person plan or you have a shared plan, even if one person is getting care and the other one is not. Now, your premiums will stop as long as you are on care, as long as you are receiving benefits. The minute you stop receiving benefits, the premium payments will start again. okay? Another one you need to know about. Can your premiums increase? Yes, they can. And yes, they probably will, okay? So just know that if you're, 52, my age, or 62, you could be paying 20 or 25 years at a premium level that starts out here, goes up to here, and if you cancel your policy, unless you get a return of premium rider on your policy, there's nothing coming back to you. In most cases, in the policies that we design, it's really use it or lose it. People complain about that, but you know what? I tell them this. You have auto insurance. You have homeowners insurance. You have life insurance. You have disability income insurance, maybe. Your goal is to not use the insurance. This is a necessary evil for pretty much all of the clients that we work with here at Personal Financial Strategies, because our clients will never be poor, and they're not so wealthy that they either want to, or in most cases, can afford to self-insure. It's really that big slice of Americana, the middle and upper middle asset and income class. Okay, so another things that you need to know. There are different policy structures as far as lifetime premium. Or there's something called a 10-pay, where you pay 10 years and you're done. There's even policies you make a one-time lump sum payment and you're done. These may be beneficial to you and they may be worth exploring. So, let's give you an exact example of a long-term care insurance policy that Robert Hart and I recently delivered to one of our clients, actually two of our clients, and you'll see what this kind of thing can cost. Okay, so real life example, we just delivered this about 10 days ago or so. Husband 60 years old, his wife 57 years old, both non-smokers, moderate drinkers. None of the nasty stuff that's happened in life has happened to them yet, meaning no heart disease, no cancers. I think there's a little incidence here of high blood pressure, but that's really about it. So these were really pretty healthy folks, 60 and 57 years old, okay? We got a shared plan. We got an 8-year or 96-month benefit pool, okay? We got a plan that offers a continuum of care anywhere they want it. At home, adult daycare, independent living, assisted living, nursing home, and then hospice care at the end, okay? Continuum of care. We got a 90-day waiting period before the benefits kick in. We do that a lot of times so the Medicare benefits that can be a certain percentage of typically the first 100 days can coordinate with this 90-day elimination period. So we got a 90-day elimination period. We got a $150 a day daily benefit. So $150 a day is $4,500 a month, is $54,000 a year. 8 years is $432,000 of benefit. We got an inflation rider. We got a 3% per year compound inflation rider, and that is that initial pool of 8 years times $54,000 a year, or $432,000, grows by 3% per year. For folks that I consider young, 60 and 57, an inflation rider is important. It's also part of the it's almost half the cost of the policy, folks. It's expensive. But again, life gets more expensive, and so we've got to have an inflation rider. And with a 3% per year compound inflation rider, that $432,000 benefit pool grows to $864,000 in 24 years. So it grows, okay? It's again a tax qualified plan, so the benefits when delivered will be tax free. And again, once one of the spouses is getting benefits, the premium stops. So here's the $64,000 question. What did that policy cost? Was it $7,000 a year? Was it $10,000 a year? Was it $15,000 a year? Was it $2,000 a year? it was $3,061 a year. Now, I can't tell you relative to your own world if $3,061 per year is expensive or not. That's part of your analysis, and if you hire us, our analysis with you together to determine if you need this, if you can afford it, and the best way to structure it. But here's how I look at it. $432,000 in tax-free benefit was created right away for a cost of $3,061 a year. So this client obviously took the policy as part of their comprehensive financial plan through us at Personal Financial Strategies. So there are other ways to combat this possibility of needing long-term care insurance. I'll just touch on those for a minute because there's some new things out there. According to 2006 Pension Act that was put in by President Bush, long-term care insurance can also be provided to a certain degree through some income annuity planning. That's a very nice thing. And there are actually life insurance policies that, when structured properly, come with a long-term care insurance rider. So for folks who say to us, you know what, I'm never going to need it. I'm not going to get sick. My kids are going to take care of me. You know, like I said for my dad, I'm going to put him on an iceberg and give him a gun with a bullet and a TV and a channel changer, laughingly. Don't worry, we won't do that. But for those folks who say, I'm not going to get this long-term care insurance, I'm never going to need it, whatever the reasons are, and they have money set aside that's legacy money, we may look at one of these life insurance policies with a long-term care insurance benefit built in. So you have some choices, folks. If you want to learn more, go to the www.naic.org. It's either naic.org or naic.gov, and then type in long-term care insurance. Or if you really want to get into it and learn about policy design for you and your family, call me, Les Goldstein, or Robert Hart here at Personal Financial Strategies. Our number is 847-268-3670, 847-268-3670. I promise you, you'll be glad that you learned about this. Thanks. Bye-bye.